Hi, I'm Lee Martin, and I'll be your presenter today. I'm a licensed professional counselor, as Lauren said, and I'm at the point in my career of about the 20-year marker. And so throughout my career, I've supervised a lot of therapists, and I've been a therapist in both outpatient settings and inpatient settings. And I've had a wide variety of experiences and talked to a lot of therapists. And so this topic is became really relevant in seeing people at different sort of phases in their career. And so I'm really excited to talk a little bit about this. And I don't see a whole lot of workshops on really burnout or increasing empathy. So I was really excited to get this information together. And as I did my research, excuse me, as I did my research on increasing empathy and really finding meaning in the work that we do, I was, really excited about it. I was talking to a colleague here about some of my findings and really getting excited about it. And as the colleague left my office, the cleaning lady came in and I looked up and she said, "Boy, you look really tired. When is your next vacation?" And so it really showed me that sometimes we get tired and we get burnt out, and it comes in different ways. And so luckily, I've had enough sleep last night, and so I'm really excited about presenting this information to you, and hopefully you'll find some helpful information here. I do want to say this is a perspective, and it's backed by research and clinical data, but it's also a perspective and kind of an interest area that I have in mindfulness and taking good care of ourselves and really finding meaning in our work. So hopefully it's helpful for you as well. But I do want to start by saying that I really do want to thank you for the work that you do. We're definitely not in a field that we're thanked all the time. And we don't work in sales where maybe we get a bonus and so we get sort of this instant gratification. The work that we do, we can go a while without being thanked. And sometimes we don't even know the impact of that we have on our patients or our clients. And so sometimes it can be a bit thankless. So I want to be the first one to say thank you for the work that you do. And looking at some just the impact of mental health work on society, what we know is that we help society. We help people show up to work. We help people have fewer sick days. People have less disability. People have fewer medical problems because of the work that we do. We're able to help people function better in their daily lives, help them function better in their marriages, their relationships with their families. We lessen the impact of trauma in people's lives, and that's huge. That's a big thing that we do that we may not fully ever understand the impact of that on an individual that we're working with, but that's part of what we do, is help somebody walk through the pain of their past. We decrease levels of depression and anxiety for our patients, and this actually saves lives. And sometimes we may not know that we save lives. We're not firemen going into a burning building and instantly saving lives a lot of times. But what studies show is that just simple cognitive behavior therapy for someone who's having suicidal ideation, helping them learn alternative thoughts from negative thinking, from suicidal thinking, can reduce the rates of suicide by 50%. So that's huge. And that's what you do. That's what you do. So I really do want to thank you for the work that you do. And it's my honor to be able to present this information. Um, all this important work that we do can come with a price, though. Sometimes we have ourselves have anxiety and states of depression or different levels of burnout. And so sometimes it comes with a level of burnout ourselves. So sometimes the old saying goes, if you're seeing a therapist, make sure they're seeing a therapist too, because the work that we do is really heavy. So sometimes we get a little burnout. Do you ever feel compassion fatigue, as they call it, or states of burnout. And so you know the signs: irritability, sleeplessness, anxiety, depression, addiction, those kind of things. Do you feel that way? So sometimes we have different levels of burnout. And believe me, you're not alone. The APA did a study in 2018 about the levels of burnout, and up to 61% of mental health practitioners experience signs of burnout that they reported. And the meta-analysis showed that about half of the therapists they sampled reported moderate to high levels of stress and burnout. So we're definitely not alone when we come to work tired, or we come to work and we're not quite in the mood to do what we do every day. So this is a very real thing. And you're also not alone. Naomi Raman, the professor of medicine at University of California in San Francisco, had a great quote that said, "The expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as being able to walk through water without getting wet." So you're not alone. This is a common phenomenon, and it's a natural, normal phenomenon that we have. So I've had the opportunity to speak with a lot of therapists on their rates, their levels of burnout. People at the beginning of their career, who are very excited about the work that they do. They want to change the world. And I remember that feeling myself. And then getting to sort of mid-level career, 15 years in, 20 years in, career therapists, and now finding themselves kind of struggling to make a living now that they have families or other things, and saying, I don't have other skills to fall back on, and I'm not sure if I'm finding the meaning in the work that I do anymore. And so I think it would be beneficial to almost have a support group sometimes for therapists, so we can talk a little bit about how we handle burnout rates or compassion fatigue. Um, So we're going to do a little exercise here. And wherever you're at on your computer, take a little break and close your eyes for just a minute. And I want to get back this energy that you had, just at least for a moment here, the energy that you had when you first started this field, when you were first picking your major in college or in high school, when you first kind of knew what you wanted to do with your career. You had choices. You could have picked accounting, you could have picked engineering. The world was pretty much wide open. And you chose the helping profession. You chose psychology or nursing or medical school. And what was that like? Think back to that excitement of what you had in mind and how you could really help people. And so when we close our eyes and we think back to that moment, we think, why didn't I choose another career? But I chose this one, and it provided deep meaning for me. Most people will say that they chose this field because they wanted to help people. That to some degree they wanted to help people. And I know my story was real similar. I did some volunteer work through a church, and I really enjoyed helping people, and I knew I wanted to figure out how people think and how to help people of different cultures and different situations in life. So the energy to help people was there for me, and you have your own story. So I would encourage you to get a sticky note or some kind of piece of paper and write down what that was for you that led you into this field in the first place. Write it down, stick it on your computer so you can kind of come back to it in your mind sometimes when you're feeling this level of burnout or this level of frustration with some of your clients. So we had, I supervised a mobile, Tulsa's first mobile crisis team back a long time ago before COPES. And most of the people that do crisis work, the therapists and case managers and nurses that do crisis work, at least back then, were generally pretty type A people, pretty high strung, pretty passionate about the work that they do. And I remember we had 2 meetings a day to talk about our cases. And so people got in this agenda of really cutting down the other team and saying that the daytime staff isn't as good as we are at solving crisis, and they're lazy. The night crew doesn't want to do this, and so it became kind of a bash session there for a while and pretty heated. So we called a retreat, a little timeout, and we all kind of regrouped. And we came back to this idea. What was your original intention? Because people were looking pretty miserable when they came to work. And so it got me thinking, why would we want to come to work if we are that miserable? And so people had all kinds of answers about why they chose this field in the first place. But what it did was kind of realign the mind to, yeah, this is something that is deeply meaningful for me. So it's a great place to start, is to think about why you got in this field in the first place. So most people say that they wanted to help people. So what does that mean? And so in talking to different therapists and other people in the field, I kind of started writing this down. What does helping people mean to you? And these are some of the answers that we came up with. Helping people for me means doing more for people, enriching and fortifying people's self-knowledge so they can overcome difficulty. And I love the fourth one there. Since I have overcome trauma myself, I really wanted to give back. So that's some true empathy. If I understand what it's like to have trauma myself, and I really want to help those who are going through it. And the curiosity that we have about the why in myself. Why do I behave the way I do it in certain situations? And why do others behave the way they do in certain situations? So the group that I supervise now, the inpatient therapy group, I asked them this question too. And these are some of the answers that they came up with, which I thought was very interesting. What does helping mean to you? And so these are some, when I saw this list, I thought, what a great group of people that I get to supervise. Helping people means empathy. It's a challenge to help other people, wanting patients to be successful, wanting to see people thrive, teaching patients how to help themselves. And that's really key as we look more into empathy. And some people said it was a higher calling, a calling by God. So think back to what helping actually means to you and write that down and come back to it when you need to. So, but with all this helping, why does burnout occur? Burnout occurs for several reasons. Dr. Michael Gordon, a clinical psychologist and researcher, studied a lot of these people who reported mid to high level rates of burnout. And these were some of the reasons that people reported burnout. So take a look at this list. And can you relate to any of this? We're doing what we want to do, but yet we feel burned out. And some of these are reasons that you might be able to relate to. Like we talked about earlier, the return on investment is not always obvious. Working intensely with people in turmoil can be really exhausting. Are you tired at the end of the day? Therapists can be vulnerable to vicarious trauma. Do you take home some of the deep, heavy stories that you hear at the end of the day? One tip there that I have is I have a spot that I look at when I leave the parking garage each day. And it reminds me, because it's become a habit of mine now, to let go of work. When I'm driving home, I look at this statue and it reminds me to let go of work. And so I've trained my mind to now come right into the present moment and either look at a sticky note I have in my car or something around my rearview mirror or turn on the radio, something that's going to keep my mind in the present moment and leave work at work. I love number 4 because I can relate to this. It's not easy being idolized and or despised by clients. Sometimes the same client and sometimes in the same session. I've had that happen before too. Number 6, paperwork and other administrative tasks can crush your spirit. We didn't go to grad school to learn how to do a great treatment plan or to fight with insurance companies. And so sometimes those can crush our spirit over time. So that's why sometimes burnout occurs, and maybe you can relate to some of that. So why increase our empathy? What's the benefits of increasing our empathy? Carl Rogers, the father of client-centered therapy, said it's actually essential. in our patient interactions, if we really do want to help people, if we really want to see the change in people, empathy is essential in those therapeutic settings. Compassionate behavior typically follows empathy. In some studies that we'll go over here, empathy actually protects us from burnout. And I read an interesting study about general practitioners that said it's a quality increasing element in their practice, that they actually spent more time seeing their patients actually felt heard. And the result of that was satisfaction surveys went up, less illness, less repeat visits, because they really felt heard and understood by the general practitioners. So an increase in job satisfaction, if I can really get in touch with what somebody's feeling and relate it to something about myself, I really see the human condition for what it is, and it really does increase my job satisfaction. An increase in a sense of spirituality, and that's an interesting one too, is we know that in a lot of different faiths, it's the calling of us to sense other people. The Apostle Paul in 1 Corinthians chapter 9 said that I might become all things to all people that I might save some. The Isaku Akita, a Buddhist philosopher, said a person who cannot genuinely emphasize with another person will never exceed as a leader. So much of what ails society today is a result of too many people in leadership who cannot identify with the plight of their fellow men and women. And Gandhi actually said, I call him religious who understands and emphasize and has empathy for those that are suffering. So an increased sense of spirituality is another benefit of increasing our empathy. And it improves our everyday relationship. If I can understand my family in a deeper way, or I can understand my friends in a deeper way, or even the person, that I don't know that well, it also improves my relationships. But empathy can be tough, and empathy is something that is learned, and we'll talk a little bit more about that, is how empathy is actually learned, a learned behavior to increase empathy. Brene Brown said empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that also knows that feeling, and that can be tough, because I have to dig in sometimes to things that I've gone through in my life that maybe I've tucked away. So self-knowledge is really important. So let's take kind of a deeper look at why this is so important and really get to the bottom of how interesting human beings can really be in relation to me as a fellow human being, just how interesting that can be. And finding interest in this area, even when I've been a therapist for 10 years or 20 years or 30 years, and I think I've seen it all. Empathy is really important, and getting in touch with ourselves is really important. So let's kind of look at really what is the definition of empathy. So it's defined as the feeling that you understand and share another person's experiences or emotions, or the ability to share someone else's feelings. But as opposed to sympathy or feeling sorry for another person, which automatically generates feelings of pity, which is sometimes not helpful in situations where people are in pain. They don't need you to feel sorry for them. Sometimes people need to feel understood. And you've probably seen that play out in your work setting sometimes. When I may not have the great technique to help somebody, or I may not even understand their world, but if I can empathize with their feelings, it can really make a difference in how they hear me and how they're helped. So empathy becomes the bridge, according to Industrial Psychiatry Journal in 2016, said empathy becomes the bridge that connects two people together and creates the space for more genuine healing. Understanding and compassion. By working on our empathy, it allows us to hear others' point of view and spring us forward into automatically becoming more helpful. So it's a bridge that connects two people. I really like that, and help us to understand each other. Empathy is, according to, once again, a Carl Rogers statement. He said it is the conditions that create healing for people in a therapy setting. And so the conditions he said are genuineness, unconditional positive regard, and accurate empathetic understanding. So Carl Rogers in 1957 had this quote, and he said that what he didn't say was, I need to bash someone over the head with a bunch of theories or my brilliant diagnosis or prescribing therapies that can fit into a particular modality of CBT or DBT or any other modality as I kind of wait for the client to give me a chance to prescribe my wisdom. What Carl Rogers said is we have to create an atmosphere of empathy, of understanding, of really fully understanding what it's like to be a human being. So think about it for a second. In your daily world and how you interact with your patients, what is your framework for listening? How do you approach your patients? Is it more from an advice giving standpoint? Is it your own viewpoint? You know, when we see the world in the way it ought to work, and I've seen this play out in different sort of treatment teams, that sometimes we have to be reminded that this is a psychiatric facility. People aren't always gonna behave in the way that I want them to, or behave according to my own viewpoint. So what is your framework for listening? What about thinking about all the things you have to do? We are very busy people, and sometimes our patients have a lot to say. And so sometimes I'm thinking about the next thing or thinking about the next thing, and I'm not giving my patients my full attention. Of course, waiting to give the next brilliant statement that I have. But the last two in this list here are empathetic. What would it be like to have that experience? I didn't come from the same background as this person. I don't, for example, have voices that I hear, hallucinations that I experience. But what would it really be like to have that experience? And are there actually feeling states that I can relate to? You know, more vulnerable feeling states like fear, anxiety, humiliation. Can I relate to those things? Can I really get into the framework of the patient that I'm working with? And if you're having a hard time with that, think about the last year and a half. Studies show that in the pandemic that we've had during COVID, that most people have reported these feeling states throughout the pandemic. And maybe you can relate. The pandemic brought up a lot for us. Depression, anxiety, being conflicted, especially a pandemic in light of a political season that was very divided. We're conflicted a lot of times. Do I wear a mask? Do I not wear a mask? Do I get the vaccine? Do I not get the vaccine? You know, and it's very tough sometimes. Sometimes there's an increase in addictive behavior or compulsive behaviors you might notice around the house or with your friends or family. We've been together a lot, so maybe there was an increase in family conflict or isolation or loneliness or just increase in impatience or anger. Can you relate to any of these feeling states? We all have been going through this together, including ourselves and our clients. Have you ever gone through a period of time where you were victimized in some way or bullied during a period of your life or treated unfairly? Have you gone through depression or anxiety? Look at all these feeling states. What exactly were you feeling? You see, the longest list there is anger. We don't respond real well a lot of times when somebody's angry at us. But look at all the more vulnerable feelings underneath anger. And so if we've experienced any of these feeling states in our lives, it turns out we're not much different than the people that we serve on a daily basis. So the key to developing more empathy and to gain this skill and to really develop strong connections with our patients or our clients is to really become insightful into our own experience. So what are some techniques that we can use that increase our empathy? And I can't say enough about mindfulness. Obviously, mindfulness is about awareness. And so we'll go with this definition from Dr. John Kabat-Zinn, who for 30 plus years did research on the impact of mindfulness on increasing our empathy and decreasing our levels of stress and increasing our healing and finding meaning in our lives and the lives of other people. So as a researcher, he came up with a working definition of mindfulness. And so what he said is that mindfulness means paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. And this is an important definition. It's an important definition because it brings up what feeling states go through our mind in any particular moment, what we want to avoid, what we don't want to think about, or the thoughts and feelings that we cling to, which has been identified as suffering that we go through. So if I'm learning and naming my own thoughts and emotion, I can recognize those also in my patients that I work with every day. So what I would encourage you for is write yourself a sticky note to remind yourself to practice mindfulness every day. If you don't already have a practice of mindfulness, find something that you can tune into every day that'll tune your mind into the present moment. The most common thing that we use is breathing because we're always breathing. So tuning into the breath, at the nose or at the belly or wherever it is, and not doing anything else, but trying to focus in on the breath. And if your mind wanders off, it's normal, it's natural, it's what happens. Pay attention to where it goes. Like what compelled your mind off of breathing? And then just notice it, label it as a mind state, and then working on letting go of it and coming back into breathing. So with mindfulness, we learn a lot about ourselves. And we learn to look at it non-judgmentally. And if we can learn and cultivate this practice of non-judgmental awareness, we can certainly cultivate this in dealing with our patients too. So mindfulness is incredibly important in learning more empathy towards our clients and our patients that we work with and our daily lives. So what are some more specific techniques that we can use when we're dealing with and growing our empathy and dealing with more patients? So one interesting technique that comes to mind is called beginner's mind. And I'm going to go back just for a second here and leave this on here. We had a great speaker, Dr. Judson Brewer, that came in here that wrote a great book called The Craving Mind. And these are some of his quotes about mindfulness. He said, when I'm truly present for my patients, mindfulness practice helps me not to jump to diagnostic conclusions or make assumptions, and it fosters a deeper interpersonal connection as well. So just that practice of stopping and paying attention to the present moment for even 15, 20 minutes a day makes a big difference. My clinical encounters with my patients and my own mind have come together in ways that have helped me understand the world in a much greater clarity. So finding really deeper meaning in our work that we do. And so remembering the benefits as a mental health professional and the benefits of mindfulness. And so if you don't have a mindfulness practice, I would encourage you to start one. So the technique that we'll look at here in this slide is called beginner's mind. So what do you bring to each session? Do you bring your theoretical orientation? Do you bring your credentials? Do you bring your hurriedness? What is it you bring to a session with some of your clients? I would encourage you to try this. Try beginner's mind. Beginner's mind doesn't bring anything to the session but a brand new moment. Your interaction with that patient in a brand new moment. We've never been in this moment before. So almost like a childlike awareness with this moment. The saying goes, in the beginner's mind, there are many possibilities, but in the mind of the expert, there are few. So write down beginner's mind. When you have a particularly frustrating client or frustrating patient, write down beginner's mind and try to start fresh with that patient. Treat it like it is. You've never been in this moment before. So what would it be like if I came in to this moment with a beginner's mind? It gives us infinite possibilities because we come to it fresh. People actually feel seen and recognized in a way they might not otherwise experience with a judgmental mind. And so the beginner's mind is a powerful reset on the mind sometimes. Um, Albert Einstein knew something about the beginner's mind. When he was 5 years old, he was sick, and his father gave him a compass watch. And he was really curious about how the hand on the watch pointed in the same direction all the time. So it developed an intense curiosity about magnetic fields. And I don't have to tell you the history of Albert Einstein and the impact he's made on our culture. One of the quotes that Albert Einstein said is that imagination is more important than knowledge. Knowledge is limited, but imagination empowers the world. And he said, I don't really have any special talents at all. He goes, I'm only passionately curious. What if you approached one of your patients that way, just with a beginner's mind, a curious mind, and let go of everything else for a few moments and just let someone talk? Another technique that can really help us grow our empathy is called loving kindness meditation. And loving kindness meditation, or called metta in the Pali language, is a mindset. And it's deliberately cultivating positive, sympathetic joy to ourselves and others. There are actually treatment facilities based on metta or loving kindness meditation. And it's been studied scientifically and what the effect that this has on it. But it's got to be an intentional practice that you have. And studies say that 7 weeks of this type of meditation increase empathy, increase gratitude, increase hope, interest, awe, and these produce an increase in mindfulness, purpose, increased our relationships and our social supports, decreased illness, and decreased depression symptoms. So what is loving kindness meditation, and how do I practice it? So when we talk about mindfulness, we talk about an anchor into the present moment. Earlier, we talked about breathing being the anchor into the present moment. With metta or loving kindness meditation, we use phrases that we can focus our attention on, and we carve out the time to do this. So take 20 minutes a day to use these statements, use these phrases. And the first in loving kindness meditation is to use the self. So you close your eyes and you'd use these phrases as you direct them towards yourself, such as, may I be safe. And of course, we want to be safe from harm, safe from getting in a traffic accident, or safe from anything that might happen to us in life that might jeopardize our safety. So just wishing myself safety. And the next one is, may I be well. So well, not ill, not coming down with any kind of sickness. May I feel good, things like that. Wishing myself wellness, mental health, mental wellness, physical wellness. And the third one, may I live with ease. So ease, may I navigate life's issues, life's ups and downs, life's stressors with a sense of ease. And the last one, may I be happy, truly happy. Not like Facebook happy or fake happy, but truly happy deep down. And what's interesting is when we first start saying these phrases, they may be a little awkward if we're not used to it. But once we say them over and over, you'll notice your mind's relationship to these phrases. That, especially when some people get down to, may I be happy. And some statements that I've heard is, I don't deserve to be happy. I don't know what happiness really is. So pay mindful attention to your mind's relationship to these phrases as you say them to yourself, and just repeat the phrases. The touchstone for your attention is these phrases, and just keep coming back to them. So you start with the self, and then some people will stay on the self, especially if people struggle with self-love. They might stay on the self for a while, for a week or 2 weeks or even months, until they start to notice increasing self-love. And the next step is to move on to a loved one, someone you really love and care about. And you say the same phrases. May you be safe. May you be well. May you live with ease. And may you be happy. And that sometimes is pretty easy to do when you're thinking about a loved one. Because we really do. We wish our loved ones well and safety and not getting sick, being well, that they navigate life with plenty of ease, and that they are really happy, truly happy. But it starts to change our mind, more empathy, more desire to help other people. So the next step is a neutral person. Maybe it's someone that you see every day at the convenience store when you get coffee, or someone you walk past at work and you really don't have a necessarily a strong opinion about them, or a negative or positive opinion about them, pretty much a neutral person. And you bring them to mind during this meditation, and you wish them the same phrases. May you be safe. May you be well. May you live life with ease. And may you be happy. And you repeat those phrases until you start to really feel it. You start to really feel that you do wish this for people in your life that you may not even know. And then sometimes one of the most challenging things is when we move to a difficult person in our lives. Someone that we've had trouble with, that brings us a lot of strife in our lives, and really wishing that person well too. And just pay attention to your mind as you wish this difficult person well. What comes up for you? Resentment. Maybe you don't want that person to be well at first, but you keep coming back to the phrases over and over until you find a sense of peace. And so loving kindness meditation, again, is a big part of treatment centers, especially you can imagine addiction treatment centers where self-love is really a difficult place to go. And finding true and wishing other people in their lives, difficult people, true happiness. So this is been well studied, and it's a place where people can learn more gratitude. Commonalities practice. So studies say it was discovered that students with high levels of empathetic concern had statistically lower scores of burnout over time. So write these steps down, step 1 through 5. And when you have someone that you're having difficulty with, go to these phrases. Just like me, this person is seeking happiness in their life. Just like me, this person is trying to avoid suffering in their life. Just like me, this person has known sadness, loneliness, and despair. And just like me, this person is seeking his or her needs. And just like me, this person is learning about life. And when I practice this commonalities practice with myself, I noticed that my feelings of anxiety about a person, or feelings, negative feelings about a person, really start to subside, because I start to see they're not a whole lot different than me. And so the commonalities practice, write these steps down. And when you're having a particular difficult time with someone, come back to these steps and see if it doesn't make a difference in your interaction with that person. The 5 whys. The 5 whys is a technique that we can use to build more empathy. And this is actually a business model to really get down to the root of a problem in business. But now that we can translate into working with other people, I think it's really helpful. So this came about, I was doing some training with law enforcement. And what we were learning is people with mental illness were being incarcerated instead of sent to treatment, because law enforcement would come onto a scene and they'd see this belligerent person with psychosis who might be lunging at them or creating an aggressive scene in their front yard or in an apartment complex. And the police were taking them into custody and just arresting them where they wouldn't get treatment. And so we started trying to do this training with law enforcement to create a little more sensitivity around this. And so with the help of the Mental Health Association, we had some headphones. It was a cassette tape at the time, and they recreated what it's like to have paranoid hallucinations. It was really scary to listen to it. And it went on for a little while. And during the class, we gave a case study of someone they might have come in contact with. someone who grew up in an abusive home, who had a mother that had schizophrenia, who was abused by their father over time, who left home, started their first job when they were 18 years old at a fast food restaurant. And during one of their shifts at a fast food restaurant, developed psychosis, like a lot of people do when they're 18, 19 years old, and started becoming really paranoid. They were sent home from work and they went to their apartment, dug holes in the wall because they thought that that the place was being bugged. And they started putting tinfoil all over the air conditioner vents, thinking poisonous gas was coming onto them. The neighbors became very concerned and called the police. And so the police arrive onto the scene to see this person who's screaming and paranoid and lunging at them. And so the police, and I'm glad they're there to protect us for sure. But what we did in this training is we asked them, why do you think that they're having this reaction? And so the answers were different with the different members of the class, but some of them because they're mentally ill, some of them in more condescending tones. And why do you think that is? Well, because they developed schizophrenia. And why do you think that is? Well, because they may have gone through some abuse in their life, and they had a mother that was schizophrenia, so maybe it set off this process. And why do you think that is? Because of tremendous abuse in their life. And why do you think that is? Because of an unhealthy home and a home life that wasn't so positive. And so fear, what do you think they're feeling? They're feeling fear. And everyone in the room could relate to that fear. And then what they came onto the scene was this fear manifesting itself in paranoid delusions and hallucinations. So we asked the police officers, have you ever had similar thoughts and feelings or situations in your life? And hopefully they've never had hallucinations, but they all understood fear. And these police officers knew what it was like to be in a situation that they felt out of control or unsafe. And that's exactly what this person struggling with psychosis was going through. So the 5 whys, and really taking the time to take a deep breath and to really understand what sometimes your clients or patients are really going through. And then, have I ever had similar thoughts and feelings or situations in my life? We can work on our empathetic phrases. And these are very powerful ones that through some studies have shown that people tend to respond to because they think you really understand them. They think you're really getting into their world. Things like, I really do understand how you feel. You're in a tough spot for sure. Wow, that sounds really terrible. You must feel really helpless. And that really does hurt me to hear what you're saying. And I really support you. I support your position here. So sometimes these phrases can really help us communicate that we're there for our patients and our clients. Here's another technique, and you can write this one down too, the acronym HERE. So sometimes when you're running through your day and you're going pretty quickly, as we do in our inpatient unit, and our therapists are going really fast, sometimes we need to stop and practice this technique of HALT. And just go back into the office, halt whatever you're doing, and offer your full attention. Take a deep breath and enjoy the breath as you choose to receive whatever's being communicated to you, wanted or unwanted. Participate in this discussion with the patient. Ask yourself, do I really know what they mean? And if you don't, ask for clarification instead of making assumptions, and bring a mindset of openness and curiosity to the interaction. You might be surprised at what you discover. And then reflect back to them what you heard. And this tells them that you were really listening. So HERE, the acronym HERE, can really help enhance our sense of empathy. These techniques work, and the brain is really wired for empathy. According to the greater good research that's done out of Berkeley's Greater Good Institute, who studies the roots of compassion, happiness, and altruism, that the brain is really wired for empathy. Sometimes there's a lot of things that can get in the way of that empathy. And so we just need these practices sometimes to help us grow in our empathetic understanding of people. So the 6 habits of highly empathetic people are listed here, and I'm going to let you read them for the sake of time because I know we're running out of time. But these are the benefits in our daily lives of developing greater empathy towards other people. We can really inspire mass action and social change if we really understand other people. And that goes back to our Psychology 101 classes where we learned about the Robbers Cave experiment, where young kids, if they're working on the same side of a project, that they really do start to help each other, even when they were against each other at first. Understanding each other helps us join together to create change. So preventing burnout, we know the techniques that we need to do. We need to practice self-care. We need to develop healthy friendships. We need to eat healthy. We need to get better sleep. And sometimes these are really hard. But I wanted to put this slide in here because we know we need to do these things. But sometimes it's a matter of digging deeper and understanding people in a kinder way and in a more relatable way. Audrey Hepburn said, "Nothing is more important than empathy for another human being's suffering. Nothing, not career, not wealth, not intelligence, certainly not status. We have to feel for one another if we're going to survive with dignity." And John Kabat-Zinn said, "If we have any aspirations to affect the future, the only opportunity that we get is in this moment. So show up in this moment." And that's as a result of practicing mindfulness. So I really do appreciate your time with this presentation, and I really do want to return to thanking you once again for what you do, especially during this time of COVID, of political divisiveness, of social media and increases in anxiety, increases in depression. We need you out there. We need you and what you do every day for your clients and your patients, and to look into the eyes of someone else and really have a deep understanding for what they're going through, a relatable understanding of what they're going through, and help communicate that they're not alone. And none of us are alone in this world and what we're going through, that we can all relate to each other. So thanks again for your time, and I really do appreciate it.